The oral polio vaccine has cut the number of polio cases worldwide by 99% since 1988. But for the past 10 years, eliminating that last percent has remained a challenge. Even though the total number of cases has declined, experts say every time they have knocked the virus out in one country, they have seen it pop up in another. Ellen Ogden is Worldwide Polio Eradication Coordinator for the U.S. Agency for International Development.
We have the highest population immunity throughout the entire world right now. We're really talking about just a few districts in a few countries with populations that have been missed for a fairly long period of time. In some cases, 3 or 4 years, certain communities or districts have been missed.
So good news is mixed with some continuing concern.
Dr. Liam Donaldson, Britain's Chief Medical Officer, is head of the World Health Organization's Independent Monitoring Board for Polio Eradication. Speaking via Skype, he said the board is especially worried about Nigeria.
The numbers were coming down, but over the last year, we've seen a worrying increase in Nigeria. Polio in Nigeria isn't just a problem for the population of Nigeria. A lot of the outbreaks that have occurred in other parts of Africa have been fed from epicenters in Nigeria. So that's why it's very important, not just for Nigeria, but for other parts of Africa as well.
Dr. Donaldson says polio eradication programs are not on track to stop polio virus transmission by 2012. While polio eradication is urgent, Ellen Ogden says these last remaining reservoirs, such as Nigeria and Pakistan, make it difficult to put a date on success.
It may not happen in the time frame that we're thinking or in the budget that we're thinking. It may take longer and cost more, but I think that the effort and the nearness merit additional investments by donors and partners, that it's still a little too early to give up on this yet. We haven't really done everything we can do.
Dr. Donaldson says with 125 cases reported so far this year, one final push is needed to get polio eradication over the finish line. Vidushi Sinha, VOA News, Washington.